Well, May 5th is observed as the World Hand Hygiene Day, and this day holds a lot of significance in our lives as we are grappling with the COVID-19 pandemic. We're now joined by Dr. Landry Kabego of the WHO Africa. Doctor, thank you so very much for joining us here on SABC News this afternoon.
Thank you so much. I'm happy to be here with you.
You're most welcome. Dr. Landry, what is the significance of this day? Obviously, now as we've gotten used to living with, having a pandemic, we've never experienced that before. People have started to be a little bit more conscious about washing hands. But let's talk to the significance then.
Thank you. I think that this day, the Hand Hygiene Day, must remind us that we need to maintain global promotion, visibility, and sustainability of hand hygiene in healthcare, and to bring people together in support of hand hygiene improvement around the world.
Yeah, and what is the main focus this year? And the reason I raise this is one would think due to the fact that there are many areas, impoverished places, whereby it's even difficult to access water. So, as simple as it may sound to some of us that, one should wash their hands, it might not be as simple to some people. And I wonder if this may also form part of the focus.
Yeah, for this year, WHO calls on healthcare workers and facilities to achieve effective hand hygiene action at the point of care. It means the point of care, it's a place where three elements come together: the patient, the health worker, as well as the treatments involving contact with patient and their surroundings. So hand hygiene should be performed when it's needed. There is 5 specific moments for hand hygiene in healthcare facilities, and most effective way using the right technique at the point of care.
Yeah, and what role does WHO Africa sort of play in making sure that there is this access to clean water? Of course, it is in the hands of the governments in each of the countries, in Africa. But I'd really like to know what active role the WHO is playing in this regard.
Firstly, we are doing some big action on the awareness on the role of hand hygiene and the importance to perform hand hygiene either with water and soap, but also with alcohol-based hand rub. We are making sure that our populations are aware. We are making sure that the Ministry of Health have the right tool that will guide them in the implementation of this hand hygiene intervention, so that's to fight against many infectious diseases. But also WHO is really calling all the partners that are investing in health, all the countries, the member states, to make sure that our populations in the region have access to clean water in sufficient quantity, but also good quality. So this also, we are trying to train as much as health workers possible that we can, so that they can also cascade this training and this information to other people in the community.
Yeah. And I mean, since last year then, when the coronavirus pandemic sort of broke out in Africa, would you say that you've made many strides in encouraging hand hygiene across communities on the continent? And perhaps you can give us some examples.
Yes. Around the continent, we've trained more than 200,000 health workers in basic infection prevention and control. And we know that hand hygiene is one of the main intervention in infection prevention and control that can break the chain of transmission of infectious diseases in healthcare facility, but as well in the communities. Also, we have disseminated many awareness material from different platforms virtual or face-to-face. And we are also making some campaign that's allow us to really disseminate the message everywhere in the region.
All right. Dr. Landry Kabego, thank you so very much for speaking to us here on SABC News. We certainly do appreciate your time, sir.
Thank you so much. It's a pleasure.
All right. That is Dr. Landry Kabego representing WHO Africa, as today we focus on World Hand Hygiene Day.